Hello, everyone, and welcome to this week's DPC Learnings, where we're going to talk about leveraging cost-saving prescription programs to work with employers. Now, I know one of the questions I often get from those of you who are using the HIM platform or working with employers or wanting to work with employers is how. And today we're going to talk to the president and CEO, John Olsen of ManifestRx, who's really transforming the way prescription care is accessed across the industry. But in particular, today we're going to touch on how they might use it in DPC practice. So, John, tell us a little bit about Manifest and who this program's for.
Thanks. So ManifestRx is essentially a pharmacy benefit administrator and solely focused on increasing medication access, adherence, and affordability. Our program works with a number of different clients across the United States. So typically our largest clients and our biggest customer base are those self-funded employer groups, DPC practices, and other organizations that are just focused on decreasing healthcare expense and adding transparency to how much their spend might be. So the program itself is all centered around pharmacy benefits. Obviously, we have a distribution center located in South Carolina. We also have a network of over 70,000 retail pharmacies for urgent prescription matters for our members and our employees. In total, our program covers over 1,000 medications, all generics, and for conditions like hypertension, diabetes, mental health, and urgent matters like URIs, UTIs, and aches and pains at the retail pharmacy. Program is offered at a capitated rate per member per month. In turn, the members and employees and beneficiaries of this product pay nothing for their medications. So end to end, most of their products are covered. We covered about 90 to 95% of the top 200 most prescribed medications in America. So it's a very robust formulary, including insulin. And, it doesn't matter whether our DPC practices currently dispense in-house or don't, or are looking to eliminate their in-house dispensing for whatever reason. We work with all practices and we can tailor a solution that's right for just about anybody.
That's awesome. I know so many people that either can get access and have the in-house dispensing already happen, but can be used in conjunction with what you guys got going on in practice or in lieu of. And so I think it makes for a great opportunity for direct care practices to continue to increase the benefits and features of their programs for folks. And so when we're thinking about winning employer business with a cost-saving RX program, tell me a little bit about how that might work for these DPC practices.
Yeah. So obviously our goal is to be our clients' partners and help them drive business growth. We're not just another expense to their practice, but rather, our program with our clients, like our DPC practices, they can use this to increase revenue and grow their membership. Or in the case of employer groups, their end user to increase the satisfaction and the retention of their employees while keeping them healthy and at work. So ManifestRx's platform can really be used as a sales tool and to provide differentiation in obviously a growingly competitive market as a DPC market is. And it can provide another revenue stream. So we can offer these rates as completely pass through to the end client. We do work with TPAs and brokers, as well as our DPC partners directly to bring savings to their customers and help them win the business. So, we like to take a collaborative approach when we work with our clients and help you capture that new business. So an example would be when we approach a new end client, our team will routinely analyze that client's current PBM data or prescribing data and identify real true savings to the program. So we'll intake a file if it's available. We analyze the percent of their prescriptions that are covered, which is typically 60 to 70%, depending on the employer, but a very considerable amount, really. We analyze the cost associated with those prescriptions, both to the plan employer and the employee or member. And then we can provide even guarantees around those savings to ensure the client's confidence. So, we can really tailor the program in conjunction with our practice to deliver those savings.
That's awesome. I mean, I know early when we were looking at doing like on-site wellness, like PBM data, like that saving alone can be hugely beneficial, especially when you have larger employers. I know one of the questions I had asked you before we jumped on the session was like, does the employer have to be of a certain size for you guys to help analyze that type of data for these folks?
Yeah, no, not at all. So we have clients from less than 50 to over 100,000. And typically we can turn around a PBM file in about 48 hours, no matter the size. We have software that helps us analyze it and display the savings. So no group is too small or too big.
That's awesome. And can you just touch on too, I know we didn't really dive into this that much in our prep, but just like, how does it create this ancillary revenue stream that you're referring to for these practices? Like what's the benefit there for them?
Yeah, so we sell this program to DPCs, but we also sell it to self-funded employer groups. Okay. And there's no reason that we can't be a partner of the DPCs and work together to sell to their client, which is a self-funded employer. So, our rate might be a low capitated PMPM of a few dollars. They can then take that and implement that price increase to their client in the next season or the upcoming client's contract to help win it. So this is not an expense that we expect the DPC practices to just incur, but rather, they can include it in their fees to the practice, but we're showing the savings to offset that rate increase.
That's awesome. And so, why would a DPC practice in particular consider utilizing this program of, going through you guys versus potentially using an in-house dispensing like some of them have in today?
Sure. And, we work with both groups. We have some that do in-house dispensing and most of our DPC practices do not. But if you're considering, in-house dispensing versus this program or considering adding it, there's no software costs associated with our program. There's no labor costs. There's no regulatory or compliance issues. We have, like I said, over 1,000 medications, both at retail and at mail order. So it's a broad range. And we have that partnership with retail pharmacies as well. So the members can go and pick up their medication at no cost wherever they are. I would say, we can tailor these specifically to practices that are doing in-house dispensing and narrow our formulas so you can continue to do that, but then take some, work off of the staff if you feel like you're having trouble growing or some of the fees are adding up. So I encourage all of our practice to take a look at their in-house dispensing and see maybe how we can help and offset.
Awesome. And I think that was going to be one of my questions. Like, do you have to offer it to all of your patients, right? Can you only do it to just an employer group that you're working with? And so it sounds like there's a little bit of a choose your own adventure here that you guys work to fit customized solutions. Am I correct in saying that?
For sure. It does not have to be the whole practice or all the members. It could be just one employer group. It could be just your own employees. Again, we'll take, membership from, a handful, 5 up to the full membership, and we can grow with you. So oftentimes we'll have new DPC practices that instill our program, and they're just launching with maybe 23 members, and we're working to help them grow their business. I will say, depending on your engagement with these employer groups, some may not want the addition, some do. So we, it does not have to be the whole membership. It can be any size.
Awesome. I love that. I mean, I think there's so many of you out there that are in different phases and stages of your DPC practice to find customized solutions like this can be hugely beneficial. My request from you all that are viewing today, if you've got questions around how you might be able to leverage something like ManifestRx as you're going out and approaching these employers, go ahead and drop a question in the chat for John or myself so that we can help support you on this journey. And I'm curious, John, as we're looking to see if the audience has any questions, can you tell me a little bit about like what it's like for the patient experience side of things? I know for me, as somebody who focuses on like operations and making sure these experiences are really seamless, like tell me a little bit about how you work with the practices to ensure that the patients are getting what it is that you guys are trying to deliver.
Yeah, so very practice specific. So we know no two DPC practices are alike, and we have a full integration and onboarding team that works with the practice to ensure that we are meeting their needs and their specific member needs. So we have a team that ensures a successful launch of the program. We do take eligibility files in, to make sure those patients have the appropriate cards and access to our portal that they can manage all of their prescriptions through. So just as an example from a user's side, they get a welcome letter from us when the practice signs up, both digitally and in the mail if you prefer. That member then has access to their portal where they can manage their prescriptions. It's as easy as really just a touch of the button. So in a DPC practice, all the provider has to do is e-scribe the medication to Manifest. And that's taken care of. From a user side, if they already are on a prescription and say they're getting it at CVS, they log into their portal, they can search for their medication and see if it's covered on our formulary, which again, 60 to 75% of them are. And then they can just type in the CVS information. I'm at the CVS down the street. Here's the phone number. Here's my prescription number, and we'll take care of the rest. We'll transfer that medication to the mail order facility and ship it to the patient within 72 hours. The patient or the member also can have full access through SMS messaging to our pharmacists, track their package, and ask any questions they might want for counseling matters. So we do a digital customer service survey every quarter where we have 500 plus respondents, and we've maintained a 96 to 98% patient satisfaction rating since our inception.
That's amazing. I know one of the stories I always tout about is like, I took my lab requisition from my OBGYN to my DPC doc and saved money. And so this is also true from the pharmacy side of things. If somebody's prescribed outside of the DPC walls, they can also use the benefit of DPC to get those cost savings through a program like ManifestRx. Erin, glad you're here. She's asking a question. Do you work with NP only practices? She's limited with on-site dispensing in her state, which is North Carolina. That doesn't have that full practice authority. So tell us a little bit about, how that works with you guys.
Yes, absolutely. We work with NP only practices. Again, if you do some on-site dispensing, we can change our formulary to accommodate you, or we could launch with our expanded full formulary, which is no problem either. We are licensed in all 50 states to practice. So whether you're in North Carolina or California, we can service those patients. And we adhere to both federal and state law when it comes to pharmacy practice. So we would take the guidance from North Carolina in this situation.
Awesome. Thanks so much. And so tell us a little bit about maybe some of the ways that you're working with DPC, or if you've got any client success stories that you'd like to share with us about how you've been able to launch and onboard your practices into this model.
Yep. So, I believe at this point we have somewhere between 15 and 20 DPC practices. And that is not just sites. Many of these are multi-site locations. And again, so when we partner with DPC practices, we do analyze prospective clients' PBM data, if we can, right? And we typically see coverage about 60 to 75% of claims. And this, as far as savings is considered, this usually ranges between 5 and 12.5% of the total planned pharmacy spend. So a lot of volume, but a minority of spend, because we know specialty drugs do take up the majority of the spend. We have a solution on the specialty side that people can learn more about, after the meeting. But again, we see about 5 to 12.5% savings on the plan side, and we see about 25 to 40% of the employer or member spend saved. So these members and employees, by having a product that's no cost, save quite a bit of money. Our average program utilization across our DPC practices is about 33%, which means 1 in every 3 members are actively using the program month to month. So it doesn't mean that 33% use the program, period. These are just active members, right? Every month, which, obviously over the course of a year grows. Some members practices, some practices are much larger and you have a higher utilization than others. Our average prescription per member is about 3. So these members are taking several medications typically. And in one example, we have a very large DPC practice. Well, it's under 5,000 members, but it's a large practice, multi-site. We track and report utilization every quarter to our clients so they can see what kind of usage and prescriptions that their members are using. They also have access to a portal real time. But in this practice, we saw 45% engagement. So 45% of their members were using this product every month. They saw savings of over $350,000 in 2023. And this is a practice that's less than 5,000 members. We have members and we have practices that have less engagement than that, under 45% that still see $7 to $10 PM of savings. So it's considerable when you're selling this to an employer group or you're talking about it to an employer group. Even with utilization below 50%, you can see savings of $10+ per member per month.
Yeah, totally significant. And what a value add to a pitch to a large employer who's got a ton of pharmacy spend. And so I'm curious, like if people are interested in getting started with you, tell us a little bit about like that process and how it might work. And I think we're going to throw up some information around how to connect with y'all.
Great. Yeah. So you can visit this site that's on the screen to learn more or set up a meeting. And, really we have a team that's engaged in onboarding and making sure we partner correctly in the right way. We have marketing material, messaging campaigns, and other digital engagement tools that we'll present. And then we can present a plan on how to approach potential clients or current clients with the program. Just takes an eligibility file. We have APIs. We also have SFTPs, if that works for your practice. We arrange that with our technical team and yours. And then within 4 weeks, we can be up and running with your practice, sending those messages to your members on how they can utilize the program. So it's very easy, simple. And again, it would be tailored to the specific practice.
And again, no minimum requirements. You're working with NPs and providers of kind of all different levels and credentials to be able to offer these types of services. And, and for those of you that are looking to get into the employer space, one of the ways is saving money. And these guys are showing you how to analyze the data. And also what I love that I heard you say, John, is like you're providing reporting for people too, right? And so that the employers want to know what their actual spend is and how their money is being saved. And so any other things that you would kind of want to say to our DPC audience around, why it might be beneficial or how you guys are supporting them in this space currently?
I would just say our company and you all have the same goal in mind of lowering healthcare costs and making healthcare easy and accessible for employers and patients. I would say partnership, goes a long way. 1 + 1 is 3 or 5. And we really have approached this from a collaborative standpoint. We are not off the shelf. We're a young company. We've been in existence for about 3 years now. And we can tailor these, specifically to individual practices, whatever they may be.
Well, welcome to the N of 1 in terms of being able to deliver excellent patient care customized to your practices. Well, thank you guys at ManifestRx for partnering with us. If you all are watching and are interested in meeting partners like John and our other partners in our ecosystem, don't forget to sign up for our Hint Summit. You guys have access to our early bird rate if you're a Hint client, but I think in general, if you sign up this week by March 31st, I hope, John, that you'll be seeing us out there and hopefully being able to share additional stories of our DPC folks that are being able to collaborate with you guys in community. And if you need support or have any questions, please don't hesitate to reach out to these guys directly. Any final words for our audience, John, today?
No, but we hope to see everybody at Hint Summit. We'll be there. We'll have a booth, and we look forward to talking about our program and how we can help grow your business.
Yeah, super excited to have you there. Thanks all for attending. Good luck in leveraging your employers. And don't forget to reach out these guys so they can assess that PBM data and help make a compelling pitch for you guys to start working and impacting the health of your community.
Thank you.